So what do I think are the biggest challenges facing medicine today?
Some of the biggest challenges we have in healthcare today are maintaining the level of insurance coverage we've achieved in the past few years. A lot of that has been or is being eroded in some ways from the political climate, so the Mass Medical Society has been a strong advocate for maintaining, if not improving, levels of coverage.
We still find people who are uninsured, and the biggest challenge is to provide health care for everybody.
I think obesity is really the major issue. 10% of the world population has obesity, and 40% of our US adult population has obesity. It really is a precursor to many major disease processes.
I think the biggest challenge that we face in healthcare at this moment in time are diseases we can't cure. And the biggest of them is the opioid epidemic. That as physicians, we see people dying at a level that we haven't seen since the AIDS epidemic, even more than that, all the time. And although we have some tools, we bear some blame for how we got there.
Another large challenge that I think is affordability, access, and reducing disparities in care. And I think that these are issues that are germane to what we do here in the Mass Medical Society and also at the national level at the American Medical Association.
The biggest challenge is for healthcare to realize the difference between overall health of the population and the healthcare we deliver as physicians. And we actually are only a small part of the total outcome picture, the infant mortality, the longevity of life at birth. So many of the indices of overall health of the community are not directly addressed through health care, hospital-based, clinic-based, doctor-patient-based. And so therefore, the opportunities are for us to reach out beyond our institutional framework and reach out to populations who may not be receiving health care, who are in communities where the social determinants, as we call them, are predominant in the outcomes.
Things that I think that we're doing relatively well, I think we're beginning to have this dialogue about issues surrounding our major chronic disease processes and inequities in care.
Right now it's an exciting time for diagnostics for infectious diseases. The new testing and diagnostic ability are really great with DNA testing and PCRs, and the therapeutics are just increasing every year. They're fabulous.
I think one of the biggest opportunities these days in healthcare is to use technology to help improve population health. Here with electronic medical records, we're able to get a tremendous amount of data, and the ability is now to analyze it and to improve healthcare for a large population.
I think if we had listened to Edward Kennedy, we would have had universal health care for everybody. And I think we have made a lot of progress in Massachusetts, but throughout the country, we need to take care of everybody.